So I'm going to show you the tools embedded within EPR to screen and treat your patients for the potential of sepsis. There are surge triggers built into EPR, and here's a screenshot of the parameters. Patients have to trigger 3 or more of these before EPR will alert both nursing staff and yourself a patient might be at risk of sepsis. So if we assume a patient is triggered on 3 or more of these parameters, when you log into a patient record, you will see this alert pop up. At this point, you can choose to either document or bypass. If you do not know the patient, it's entirely reasonable you click bypass at this point to enable you to review your patient, and I will show you where you can find it to complete the documentation once the patient has been reviewed later on. However, if you know the patient and you're able to complete the sepsis screening, then please click on Document. This will take you into the sepsis screening tool. So if your patient does have an infection, you'll be required to tick all 4 mandatory field boxes, which will generate the interventions required for your patient below. If your patient doesn't have an infection, you just click on No. Exclude sepsis and write the reason why you're excluding. So it may be a GI bleed. However, for the example of this video, I'm going to go back and say, yes, my patient does have an infection, so that I can generate the next tool that you require. So once you're happy with your answers, tick the form. So I said earlier that I would show you where to find the screening tool if on the initial alert you need to click on bypass to review your patients. So on the visit summary page, on the left hand side there is a tab called tasks. If you go into tasks, if you click on medical, although it's not showing here because it's completed, you will be able to retrieve the screening tool and complete appropriately. If through the screening tool or through clinical judgment you feel your patient requires treatment for suspicion of sepsis, we have a bundle available within EPR for you to use. This is found in requests and care plans. Under suggested care plans, it's called Adult Sepsis 6 Bundle and Buffalo. You click on the link, and this includes all elements of the Sepsis 6 your patient should receive within 1 hour of recognition your patient may have sepsis. You can see it's set out in 2 sections, investigations and interventions. For investigations, if your patients require a full septic screen, the requests are all here for you as shown. And you can see that they are all automatically ticked. So once this bundle is initiated, these orders will be generated automatically for you. You can see it also suggests if your patient's HB is lower than 70, they may require a cross match. And if you require a chest x-ray for your patient, if you tick this box, this will also generate the x-ray request for you. Under interventions, oxygen is ticked as a required treatment for your patient. Monitoring of fluid balance is also automatically ticked. This will drop onto the nursing task list to remind them that fluid balance charts need to be updated once this bundle is initiated. IV fluid guidance is here for you, and also the link to antimicrobial policy, prescribing policy. Once you've ensured all the boxes are ticked that you require, you will need to accept the bundle and sign for any orders that you've requested as shown. So here's your blood culture, you can print. Your oxygen prescription will automatically generate from this bundle. How often you would want the nurses to record the fluid balance. And all your bloods for ordering. If you highlight them all, this will generate the same information on each order. Once you've signed all your orders, it will be processing until you refresh your page. This bundle, sepsis bundle, is now initiated. What I've shown you is the adult screening tool and bundle, but within paediatrics, the same tools, two tools are available with amended parameters and treatments for the correct age of the child.